So, good morning, everyone, and thanks for being here. The last briefing we had was back on September 3rd, and the reason why I want to have another one at this time is because the progress that we've been making over the summer is fading. We started to do the right stuff, started to go in the right direction, and the last couple of months we've really took a turn for the worse. I'm not here to I don't like to give bad news. I know Dr. Whalen doesn't like to, but the reality is of where we're at. Uh, I've seen a lot of people out, and COVID's not over with. We're on like our fifth wave, if you want to count every different wave of COVID-19, the way it has changed and morphed since the beginning of this almost 20 months ago. I know people are tired, and we're tired. And we still have to run a government, we still have to deliver services, we still have to do a variety of things. And like I said early on, we had to reimagine the workforce. We had to reimagine what the world was going to be like when we went out. So we need everyone else to do the right thing. Do your job, as Bill Belichick says. Do your job. I've had a lot of people question me when I've been out. I've been to events, and I'm the only one wearing a mask. They're like, well, you're fully vaccinated. What do you got a mask on? Or I'm outside taking a picture. There's a couple reasons why I've done it. One of which we've said time and time again, even if you're vaccinated, but you're in an area where people aren't vaccinated, you still have to stay 6 feet apart and wear a mask. That hasn't changed. But I think what has changed is that people feel because they got the vaccinated and so many people are now either got one shot or two, that they don't feel like they have to pay attention or you don't get sick. You do get sick. And this vaccine that you get, whatever it may have been, really just helps you, gives an arsenal tool to keep you from hopefully going in the hospital, hopefully stopping you from going to ICU, and hopefully stop you from passing away. But we've never once sat up here and said one way or different that it was a cure-all, because there is no cure-all. And like I said, this is like the fifth wave, the way it keeps changing. So, because now we're seeing this situation around COVID get even worse, I think part of the problem is that there are media reports on a national level that COVID has dropped. But if you look at, you gotta look at the Midwest, and you gotta look down south. And if you look at what happened in Michigan in May, how bad it got hit there and never left the border of Michigan. But you look at Arkansas, Louisiana, Georgia, Texas, Florida, their vaccine rate was nil. Their people did not get vaccinated. Their governors, for whatever reason, and their health experts didn't push for vaccination in southern states. So they had that surge over the summer where our vaccination rate was high and we were doing the right thing, and it didn't hit us as hard. But it's important to note the situation's not improving everywhere, including parts of New York, here in the capital region. Places like central New York, the Finger Lake region, and western New York seem to be doing much worse than we're doing. Our vaccine rates are rising, but they're rising extremely slow. Like I said, we're slowing down. Currently, 72.4% of all Albany County residents have received at least one dose of the vaccine. 66.5 are fully vaccinated, and for a one dose vaccination rate for adults population 18 and above is at 83.5. Over the last month, we had 4,050 more people go and get their first dose. But if you compare that to the first dose of last month, prior to that, there were 7,700 additional people who got their first dose. You can see how we're dropping down. As daily vaccinations slow, we're also seeing daily infections, hospitalizations, and deaths go up. Since yesterday's update, there have been 54 new COVID infections identified, which brings us to a 5-day average of 77.2. We have 40 hospitalizations, 2 new ones since yesterday, 9 people in the ICU. So also I want to bring to your attention between September 21st and October 21st in Albany County, there were 21 COVID deaths, 126 new hospitalizations, and 2,500 COVID infections. Now compare that between August 21st and September 21st. There were 11 deaths, 118 new hospitalizations, 2,233 new infections. The month-long period before that, there were only 1 death, 70 new hospitalizations, and 1,326 new infections in total. So you see how June we slipped, we went down in July, August, we started to go back up in September. The situation now compared to the end of the summer is much, much worse. And we still have not entered into going into winter and taking a look at our numbers. It could get even worse. Between October 7th and October 14th, we reported 1 new death every day for 8 straight days in a row, for the longest streak of new COVID deaths since the beginning of February. If our daily infections and hospitalizations continue to get worse, we need to carefully how we look at our hospital systems, that we move forward with the infections to make sure we have the proper capacity for our hospitals. So last month, I should say a month ago, the percentage of Capital Region Hospital beds available dropped down to 18%, and ICU beds capacity dropped down to 7%. I believe one of the lowest we've seen, according to the governor's numbers. But it's important to keep everything in order and to beat back COVID-19. The vast majority of people are getting seriously ill, being sent to the hospital and dying. There are those not vaccinated. I think President Biden said it. This is a war on vaccinated at this point in time. I know everyone on our Facebook, they ask that $1 million question. They want to know who had vaccines when they passed away, who didn't, what are the numbers. And we try to respect people's privacy when someone passes away, that we cannot try to put all of the certain data out, which we want to, but we wanted to let that family have that moment and not let them decide how they want to say it. But here's some staggering numbers to look at. And, looking at county residents who were hospitalized with COVID between August 8th and October 16th, about 63% were unvaccinated, 63. 35% were fully vaccinated, and the remaining 2% had 1 shot that were hospitalized. Shifting to people that passed away. During the month of September, there were 10 COVID deaths. During the first 3 weeks of October, there were 15 COVID deaths, and of those 25 that passed away, 72% were unvaccinated. 72. 24% were fully vaccinated. Yes, 24% were fully vaccinated. 4% were partially vaccinated. So it shows this does work. It does help you. And I know people will hinge on the 24% and the 2%, but you got to break them cases down too. Underlying health issues. Some of them had cancer. Some of them had other issues that, again, this vaccine might have helped them prolong their life a little bit longer. But again, 72% unvaccinated of the deaths that we're having. But it's critical that we continue to increase our vaccine rates, and we're doing that by hosting small clinics around the county. You can go anywhere now, almost to any pharmacist, to get the vaccine. Moderna's out in some pharmacies right now. Some of the great news we've got, you can mix and match. I know people had questions about that. I'm not the doctor. I couldn't answer them. I was out at an event. I'm like, listen, talk to your pediatrician, talk to your doctor. Guidance will be coming out. But they're saying, they're feeling that, if you had Moderna and you got Pfizer, or you had J&J and you get Moderna, it actually really helps and builds up different immune systems to fight this. And I know Dr. Whalen will talk about that. And, it's challenging, and I get it. I know people who want to get the 3rd shot. Look at what you qualify at 65 and older, and frontline workers. A lot of teachers already have gotten the 3rd shot. People are out there getting their 3rd shot to make sure they go in the right direction. Also want to remind people that we will be giving the 3rd dose at Stephen Harriet Myers Middle School in Albany on Wednesday, Colony Central High School on Tuesday, and 2 more on Saturday. And as always, we offer the vaccine at our County Department of Health on Green Street in Albany every weekday. We continue to offer transportation and deliver to those in need. So if you can't get out, we will come to your house. None of that has stopped. We continue to do that. And again, which is also some good news from the CDC, on Friday, like I said, given the approval, which affects over 50 million Americans, with this great news that we got from the CDC, so they can get the booster shot. So, and again, I talked about mixing it. You can. I know a lot of people have questions. Take the time, talk to your doctor, and we'll get through it. Our County Department of Health is now waiting for final guidance from New York State, so we'll be able to start providing the booster and providing the booster for Pfizer and Moderna, and as we go forward. And I know they're meeting this week, and Dr. Whalen will make the decision how that's going to go out this week as we continue on. We're hoping to get the certification soon for children between ages 5 and 11 for Pfizer. That should be coming out very shortly, the guidance, which means it's another tool in the arsenal. One of the questions I got from one of the sports coaches this weekend, the different guidance and school guidance. College students in a room someone in the room gets COVID, they're 6 feet apart, there should be a seating chart, and it doesn't knock out that whole classroom. People are doing it differently. Some are being overcautious, some are not. I get it, but all college kids at this point in time who should have the vaccine shot, not unless for health reasons or some other reasons they couldn't get it, should be fully vaccinated for sports at this point in time. But there is the 14-day window, and there's a 7-day window. In the footnotes that have come out, and Saratoga County has done this, and we're discussing it this week here in Albany County, that you can test out after 7 days. And some of the issues we're having with parents and talking to parents, and I don't feel as bad for the college kids because you had the opportunity. I feel bad for the younger kids under 12 that can't get the vaccine, that can't play sports, or they're getting knocked out of school. And we have to do better, because when we were shut down, we went virtual. Was it perfect? No, it was not perfect. But now we're back in person. If parents want to keep their kids in school, and we got to do the right thing, but when kids are eligible to get the vaccine. But the issue we're having in school is that there's certain kids that parents I talk to that their kid's been knocked out of school for 28 days because Johnny has the sniffles or someone else has something going on, and being cautious, and I give the school the credit, and it's a tough decision, being cautious, they're making sure when that kid gets tested. But then that kid's put out for 14 days. And there's no online learning. We're already behind the 8 ball. We have to do better. The school districts have to do better, and these kids have to be able to go online when they're out of class, because guess what? This is going to go on this whole school year. And I don't know what the superintendents and schools are thinking of school boards. It's not ending. I would love to sit here and tell you you'll never see me again on this topic. But unfortunately, it's not going away. And unfortunately, the way our numbers are going, we are 5 times higher this month than we were last year. 5 times. Think about that. Think about how high our numbers are. And I know everyone's done. I know everyone is done with COVID-19. It's not done with us. So hopefully sometime next month we can start vaccinating kids 5 to 12, and that affects about 28 million kids in the United States. But parents, I know the argument about unmasking our kids in school. I know the argument about the vaccine, people don't want to get it. I can't explain to you, and I will tell you as I sit here, and maybe Dr. Whalen, I don't even think Dr. Whalen can answer this question, why doctors, nurses, LPNs, or hospital staff, or anyone at this point who's worked in that setting doesn't want to get the vaccine. I just can't tell you why, personal, whatever. I've seen military, men and women I've served with, that we've got anthrax, biochemicals put in our system, but won't get this shot. I just can't argue with that. I don't understand why. But one of the things, as I talked to county executives across the state, was that it got so politicized last year on a national level that people lost confidence in government. and lost confidence on the messaging for the vaccine. I'm not going to sit here and get into what this person said, that person said, but we're at full at a national level. People still, a lot of Americans in this country are afraid to get the shot because we said it was don't get it, then get it, don't trust the CDC, trust the CDC. I get it. It was a mixed message, but it's my job to say to the people and do everything in my power to make sure we keep you safe. And by keeping you safe means please get the vaccine. It doesn't mean this thing's gonna go away because it keeps morphing. We might have to get a booster shot like we do the flu shot every year. But we had a good flu season last year because everyone had the mask. Now no one has the mask. So compound the flu season, not wearing a mask, and everything else. I don't want to make any mandates about businesses wearing masks full time. Look, CDC still recommends it. I go into a restaurant, I wear my mask. I sit at my table, I take it off. You go get up to the bathroom, you put it on. It hasn't changed. But people are really relaxed now. And I get it, because you want that freedom back. And that's what this country's foundation was built on. The fact that we can believe in whatever God we want to believe in, dress whatever way we want to dress, not be prosecuted. And I get the mask thing, but you got to understand, we are going to continue to go down this road, and I'm hoping not for a worse winter than it was last year. And the way we're headed is not in a good way. And you got to understand, a lot of companies still have not come back fully. State of New York has not even come back fully. They're at like 48% capacity. We have come back fully in this county, except in certain cases where people had some issues we addressed to make sure they could stay home and be safe. But it's hard. Look at businesses are struggling because people aren't back in the workplace. It's not going to get back fully if people don't do their job, get the vaccine, wear your mask, stay 6 feet apart, clean your hands, and we'll get through this. I know it's been a long 20 months. Trust me when I say this. We struggle every day. It doesn't end. It doesn't end. But we need your help to get the vaccine and do the right thing. Dr. Whittle.
Good morning. Thank you, Andrew. So over the weekend, we learned that the CDC's document, the CDC did release the authorization for booster shots for Moderna and J&J, and we did receive guidance, clinical guidance and orders from the State Department of Health. This morning, staff is reviewing and preparing for us to administer Moderna and J&J boosters. Now, the eligibility criteria for these boosters is age 65 or older, age 18 and older who live in long-term care settings, 18 or older who have underlying medical conditions, 18 or older who work in high-risk settings. So there is a very broad swath of the population that is currently eligible. As the county executive indicated, and consistent with CDC guidance, the New York State document does talk about utilizing the same vaccine manufacturer that the person received for the primary series. If the same product used for the primary series is no longer available, or a different COVID vaccine is desired, any FDA-approved COVID vaccine can be used for the booster dose, according to FDA and CDC guidance. So how do you make a decision? And I think as the county executive discussed, it is a good idea to discuss with your doctor. Personally, after reviewing the data, I think if you have received Pfizer or Moderna, it would probably be advantageous to receive the same mRNA vaccine that you received the first time. Those that received J&J, this is a vaccine that I think many liked to receive because it was a one and done, single dose. It is effective, but slightly less effective as the mRNA vaccines, and does carry a very low risk of serious side effects. So if those that receive the J&J would like to receive a booster with an mRNA vaccine, that will be available to people. In terms of what we are seeing, As the county executive indicated, we are seeing high numbers of cases, persistent for a long period of time. We are really stressing again that the mitigation efforts that we have discussed since the beginning of the pandemic are more important than ever, because how we all act and what we all do will determine our future. This is a message that we have gotten out since the beginning of the pandemic. It is especially important now as we enter the respiratory viral season. We have received a lot of reports that there are other respiratory viruses going around. It highlights the need for testing, even if you have minor symptoms. We are working very closely with our schools. And in particular, we are getting many, many questions, as are the schools, about the surveillance testing, about diagnostic testing, and about the need for quarantine. Of the cases that we have seen in the last 2 weeks, between 25 and 40% are in the K through 12 population. So we are seeing, we know that there's a large amount of testing that is being done, and we are seeing large amounts of cases coming from those scenarios. Why is this important? Most of the kids that are infected have a symptomatic illness. We are not seeing high levels of hospitalizations in children. However, we know we still have a vulnerable population of people that are either unvaccinated or those that have been vaccinated and may have decreased immune response to the vaccine. And those are the people that we are seeing hospitalized, and those are the people that we are seeing that are unfortunately dying of COVID-19. It is really important to know, as the county executive indicated, that the numbers that we are seeing with severe illness, hospitalizations, and death are predominantly in unvaccinated individuals. In those unvaccinated individuals, it is likely that their hospitalizations and their deaths were preventable. So if you have not yet received a vaccine, I urge you to get a COVID vaccine. I have received a COVID vaccine. The county executive has received a COVID vaccine because we believe that this will protect us. My family and children have received the COVID vaccine because I believe that this is the safest thing for them to prevent illness and to prevent them from contracting illnesses that can be spread to other vulnerable individuals. This is not just a matter of personal liberty. This is a matter of how we all behave affects the outcome of the person that you are with. So it is still very important that we continue these control measures. The schools have been very, very dedicated in working with us to conduct surveillance testing. We have contracted with 10 out of 12 schools in Albany County to provide screening tests through a PCR test. And we can also work with them to provide diagnostic testing within the schools. And we have had a couple of schools that are doing that, and I think that that is a great strategy to be able to get kids who are excluded back to school more quickly. We know the pediatricians are having a very difficult time given the amount of kids that they have to see that have been excluded from schools. We are hoping to work with the pediatricians and the schools to be able to create streamlined processes for testing so that we do not hear the concern that children that are ill are having a difficult time getting evaluated because of the overwhelming number of kids that need to be tested. We have the tests that we can spread to the schools and the pediatric offices and are hoping to come up with streamlined processes so that kids with minor symptoms who test negative via PCR can be returned to school as quickly as possible. Our contracted tests are returned generally within 24 to 36 hours. And I know in different pediatricians' offices and different places that are testing around the county, there is a great variability of the wait time in getting those tests back. So where we can do this more quickly, we need to create these partnerships and need to work together to be able to get these tests back quickly. I understand parents are inconvenienced by the need for children who are contacts to stay home and be quarantined. But this control measure remains essential to prevention of the spread. Again, if you look at the way that COVID is behaving in other areas, it is largely dependent on the vaccine uptake. Our vaccination rates are good, but they can be better. We are also hopeful in the next few weeks that there will be availability of pediatric vaccination as this goes through the essential regulatory channels. And we are looking for that to change to occur within the first couple of weeks of November. Again, and I would urge parents to avail of those opportunities. We will be conducting vaccination clinics at schools. We will be, again, working with our pediatric providers and family practitioners to make sure that the vaccine can get out and is available to all that desire it for this important age group. Getting this group of kids vaccinated is going to stem the spread. Increasing our vaccination numbers is going to ensure we can get back to normal. But it is something that all of us need to work together. On the subject of quarantines, I do want to share, particularly the K through 12 populations, that our staff works to conduct case investigations on all cases. Those case investigations are done in conjunction with the schools. However, the quarantine and the calls that you get for quarantine are through the state workforce, and we understand that there is a delay, and that sometimes it can be 3 to 5 days before there is a phone call to a parent, even though they have been told their child has been placed on quarantine. This is something that we are working with the state to try to remedy, but I would ask that parents understand that if the schools have provided information to them that their child is on quarantine, that means their child is on quarantine. That means that the order is forthcoming, and we are in contact with the schools and working very carefully on this. Again, these strategies are to prevent further spread of the disease, and we know that the control mechanisms and measures that are being implemented in school are doing the best to try to prevent spread within schools. We also encourage parents that if your child is vaccinated, once fully vaccinated, they will not need to undergo quarantine if they are contacts. So this is important for parents to be aware of. It is, perhaps an incentive above and beyond the scientific reasons for vaccination and protection against COVID-19. So I really encourage parents to vaccinate and to speak with their pediatricians about this. We know this vaccine is safe, it is effective, and it works. It decreases rates of hospitalization, it decreases rates of deaths, and when we see numbers of hospitalized patients and deaths, 70% in the unvaccinated, we know that those were likely preventable deaths. So it is still essential for people to know that this strategy is the best thing that not only you can do to protect yourself and your loved ones, but it is the best thing for all of us as a population to be able to move forward to get back to normal. So I encourage parents, and I encourage those that are unvaccinated to get vaccinated. I encourage those that are eligible for boosters to get boosters. And as the county executive indicated, we are planning a number of vaccine clinics in the upcoming week. Staff is working today to implement systems to be able to include booster doses, and I expect to be able to give more information on that tomorrow. Thank you.
Thank you, Dr. Whalen, as always. And do want to remind people at our Fall Fest we just had at Lawson's Lake, we had 27 people get their booster shot there. So that was awesome. It was a great turnout. And I know when I was talking about the mask, the 3 reasons, and I skipped over it, but one of which is to support people that want to wear a mask. You know, that's the other reason why I do it. And the other reason is having my granddaughter Isla living with me the last 8 weeks because they're selling their house and haven't left, which I'm enjoying. So I have to wear a mask. I wear a mask to make sure I'm not bringing it back, because you can still get it without knowing that you have it and give it to people. And that's the other thing. You might not get sick, so the vaccine did its job, but you're going to get it and spread it to somebody that either A, chose not to get the vaccine, or B, can't get the vaccine. So I want to make sure when I'm out and about and I'm all over the place that I protect my family when I go home. As I said, do your job. Do your job to help protect other people. Any questions?